A theanine-based drink reduced salivary cortisol 3 hours later. Theanine also reduces the increase in heart rate and blood pressure under stress. Since high cortisol levels lead to increased central obesity, i.e. fat around the middle, could theanine aid weight loss? Perhaps the boost in neurotransmitters could also reduce cravings. Whatever the mechanisms, theanine does in fact seem to support weight loss, at least in mice. Theanine can also protect the liver in the case of chronic liver disease and liver injury, and aids in detoxification by increasing glutathione production. Glutathione is your main intracellular antioxidant and detoxifying agent, and when it acts as an antioxidant it becomes oxidized itself and then needs to be recycled or reduced to the active form of glutathione again. Theanine increases this recycling of glutathione as well as providing glutamate to make more glutathione. Theanine also increases the production of other key antioxidants such as catalase and superoxide dismutase that also help to protect the liver from alcohol, and it increases the activity of enzymes that break down alcohol and the even more toxic acetaldehyde that your body converts alcohol into, and that is associated with hangovers. Carcinogenic levels of acetaldehyde are also created by candida overgrowth, and some of my clients with fungal overgrowth have found some limited reduction of symptoms from taking theanine. Theanine promotes nitric oxide production, which dilates the arteries to reduce blood pressure, and we have already seen that theanine reduces the blood pressure increase in response to stress, and could thus reduce 2 risk factors for cardiovascular disease, including stroke. That's psychological stress and high blood pressure. If you're taking blood pressure medication, theanine could in theory reduce your blood pressure too much, so this combination is best avoided. Theanine may reduce lipid peroxidation, i.e. damaging of fats in the cholesterol-carrying LDL particles, which is important since oxidized LDL particles are associated with heart disease. Theanine inhibits the process of inflammatory cells binding to artery walls that initiates atherosclerosis. Ischemic stroke, when the blood supply to part of the brain is reduced, results in damage to the brain by excitotoxicity, but taking theanine in the 12 hours after a stroke shows promise as a way to reduce the volume of the brain that is damaged. Theanine also has a protective effect on cultured heart muscle cells by increasing production of the antioxidants glutathione, glutathione peroxidase, and superoxide dismutase. Theanine enhances immune function and may reduce infections such as colds and flu. One of the ways theanine improves immune function is by boosting the Th1 arm of your immune system, although for this very same reason some people with autoimmune conditions in which the Th1 arm of the immune system dominates the Th2 arm, theanine might potentially aggravate symptoms. Theanine is anti-inflammatory, and when combined with cysteine in a small pilot study, theanine reduced intestinal inflammation after gastrectomy and has also shown benefits in healing gastric ulcers. Theanine combined with cysteine also reduces the inflammation and immune suppression caused by high intensity exercise, which may be due to the immune modulating effects of increased glutathione production. Theanine has some anti-cancer activity and can also enhance the effectiveness of the chemotherapy drug doxorubicin whilst reducing side effects of the medication. And theanine also reduces the release of histamine from mast cells that drives allergic reactions and may also decrease airway inflammation in asthma. Please remember that studies measure averages and do not generally account for individual differences. Some individuals may actually sleep worse after taking theanine and should therefore only take it during the day. You can take 200 milligrams 30 minutes before you need more mental focus or to reduce any expected anxiety, and you could take 200 milligrams 3 times a day for a general boost to cognitive function and mood, as well as all of the other health benefits I have described. Theanine may be more effective on an empty stomach. Have you tried theanine and have you noticed benefits from it? Let me know in the comments below. Thank you for watching. I hope you have enjoyed this video.